Hej! Hög volym här ikväll. Välkomna allihopa och jag hoppas att ni hittar plats. Det är utsålt, men det ser också ut att finnas en del stolar kvar, så att sätt er där ni känner för helt enkelt. Jag heter Johan Wirfeldt, jag är ansvarig för debatt- och samtalsverksamheten här på Kulturhuset Stadsteatern och under fontänen. Denna underbara lokal som vi befinner oss i och som vi använder nu när själva Kulturhuset renoveras under 2019. Varmt välkomna hit till detta samtal. Vår tids mentala ohälsa är psykedelika. Svaret, eller en del av svaret ska jag säga. Vi på Kulturhuset Stadsteatern arrangerar det här samtalet tillsammans med Fri Tanke förlag och nätverket för psykedelisk vetenskap. Vi är väldigt glada att ha så trevliga samarbetspartner. Jag vet inte om ni såg det när ni klev in. Det finns ett bokbord här utanför. Där kan man köpa 2 extremt aktuella böcker. Om jag är rätt informerad så är det här första gången som Michael Pollans bok säljs på svenska, alltså här ikväll. Den har kommit precis från tryckeriet. Så Michael Pollans bok Psykedelisk renässans och Ulf Elleviks bok Förgiftad. Specialpris ikväll, 200 kronor. Köp dem och lär er allt som ni inte får lära er här i samtalet ikväll. Jag har min telefon här, mina minnesanteckningar. Det är också en påminnelse om att jag ska be er att stänga av ljudet så ingen blir störd. Däremot får man gärna twittra eller instagramma eller vad man nu känner för. Vi har en tagg som heter forumdebatt som man kan använda då. Så blir det lättare att hitta allting i flödet. Ja, det var allt för mig. Nu ska jag välkomna kvällens moderator och samtalsledare upp, som också är vice ordförande i nätverket för psykedelisk vetenskap. Det är Johan Eriksson och han kommer också att presentera panelen. Välkomna och en applåd för allihopa.
Tack. Hej och välkomna. Vad kul att det är så många som har dykt upp. Jättetrevligt att vara här. Eftersom att vi har en hitrest gäst från USA så kommer den här paneldiskussionen att genomföras på engelska. Och jag hoppas att det går bra. Om det är svårt så får ni be någon bredvid er att översätta, för jag kommer inte riktigt ha möjlighet att göra det här uppifrån. So, sorry for that, Matt. I'm switching to English now. I'm so glad to have the 3 of you here, and I will start by introducing each one of you, and then we will move on to the discussion. So, Matthew Johnson is a psychologist and associate professor at Johns Hopkins University in Maryland. He's an expert in addiction medicine and drug abuse research. And if there is such a thing as an actual renaissance in psychedelic research, I would say that Matt has been in that renaissance right from the start, over 10 years in active research in psychedelics. And he's also one of the researchers that Michael Pollans interviewed for his book. So very happy to have you here.
Thank you.
Rebecca Malm, she's a clinical psychologist, a supervisor, author, and public speaker. She's been working in primary care as well as psychiatric care, but is currently seeing patients in her private practice. Rebecca caught the attention of the public eye a few years ago when one of Sweden's most successful athletes, Patrik Sjöberg, decided to add parts of his therapy with Rebecca in a documentary aimed at lessening the stigma concerning victims of sexual child abuse. Rebecca has an extensive spiritual practice and a background as a meditation teacher. Nice to have you here. Welcome. And then we have Ulf Ellervik. He's a professor of chemistry at the University of Lund. As of the last year, he's a member of the Royal Swedish Academy of Science. He's a well-known author and public speaker, renowned for his exquisite ability to present science and complicated concepts in a more easily accessible way to the general public. Ulf has a great interest in history, and in his books and speaks, he strives to bridge the gap between natural science and the humanities.
Thank you.
Glad to have you here.
Thanks.
So, interesting people. I would actually like to sit and talk to each one of you about all sorts of things, but today we will be talking about psychedelics. So, my first question is to you, Matt. The substances we are talking about, the so-called psychedelics, they include LSD, psilocybin mushrooms, ayahuasca, and to some extent MDMA, the active ingredients in the drug ecstasy. During the 50s and 60s, there was extensive research on these substances. For the most, they were researched in clinical trials on depression and substance abuse. But for a variety of reasons, the research stopped, and for about 20, 30 years, nothing happened, and it seemed like there was no interest from researchers into these substances. So my question is, why are we suddenly seeing this surge in psychedelic research? I thought we'd dismissed these substances in the 50s and 60s, so what is different this time around?
Yeah, and as you said, Johan, that these were extensively researched from the 1950s through the early 70s, and in fact LSD was considered a breakthrough in the understanding of how the brain functioned, the nature of the mind. It was discovered around the same time that we had this emerging understanding of neurotransmission in the brain, so it was very important. MDMA was the one compound you mentioned that was not part of that earlier era. Merck had discovered it in 1912, but the psychoactive properties were not known until after the psychedelic heyday of the 60s, and so that's been part of the research in the modern era. But the answer is largely that enough time had to pass after the 1960s and early 70s heyday of psychedelic cultural use. So these shifted from these fascinating compounds in the laboratory, including in human clinical research, they started to be used by people more broadly, and it was really their association with the counterculture, the global youth culture that was emerging in the late 1960s, and that was associated with so many of the changes in society at the time, the anti-war protests, the youth movement, the changes in art and culture. And many people believed these drugs were responsible for those changes or played a role. So that scared many people in society. Another aspect is that there were some casualties. A lot of people used these drugs. Some people, many people, they did not harm, and in fact, many people claim lasting benefit from their use of these drugs. But there are definitely people who were harmed by these drugs, who had very high doses, and they had a psychiatric vulnerability, for example, a schizophrenia vulnerability, and these drugs caused some harm to those people. And people that had accidents during a bad trip, a difficult drug reaction, when they were not in a safe environment. So essentially, the clinical research, when conducted safely, like the good clinical research, there was never any reason. It was not concluded that, oh, you cannot safely do research with these drugs. They had a good track record in human research when the appropriate safeguards were in place. But nonetheless, these associations with the reckless use of these drugs and the counterculture caused a stigma in society, and therefore decades had to pass before society was ready for this paradigm to reemerge. Sort of the people that were most affected by that cultural trauma, had to sort of the generations had to move on, and a new generation came through to look at these with fresh eyes.
Thank you. So, Rebecca, I want to move on to you. As a clinical psychologist, you see patients on a daily basis, and you've been doing so for almost 10 years. When you read this book, what is does it make sense? What are people struggling with today? And do you have any idea if these substances could actually help the patients that you see in clinical practice?
I work a lot with emotion-focused therapy. So these substances are very interesting in that they will peel off layers of protection that we have. Because many times when I see a person for the first time, they say that, okay, I have these consequences of my behaviors, and I don't like these consequences. So how can I change my behaviors? And then I ask, well, why do you do those behaviors? And they say, well, because I have these emotions. Because emotions are what triggers the behaviors. It's like what triggers the behaviors, and it's supposed to lead to good consequences. So why are the emotions leading to bad consequences for these people? Then they say, well, there's something wrong with the emotion. All right, so why is the emotion not in harmony with the situation? Why is it suppressed? Why is it too big? We need to look at what causes that glitch. And I think in the book he talks about how we get set in grooves, we get set in our behaviors in certain ways, and it can be difficult to break the habits that we have, because we have them for a reason. There's a learning history behind them. There are ways that when we were younger and when we were more flexible, we learned to behave in ways that were suitable for that environment but are not suitable for our adult environment. So in emotion-focused therapy, we try to trigger the emotion to be able to give it a new setting. And I think with when I read the book, it seems like it would be helpful to kind of get in touch with those the things that causes the emotions, the learning history. Because usually when you get the emotion triggered in the therapy, then memories from the past can come up. And I think that's what he describes in the book too, that when you get in altered states, then you can actually get ways to reprogram when you first learned the emotions. So.
Thank you. We will have a reason to get back to that topic, the topic of if these substances work, why is it that they work? But first I want to get to you, Ulf. We started a topic backstage right before we went on, and I want to continue with that. But first I'm going to ask you my original question.
Okay.
Go ahead. You've been writing books for the Swedish general public for 15 years. So when I've been speaking to some American psychologists, they've described something of a pollen effect, which means that after Michael Pollans' book, suddenly there was a high demand on psychedelic therapy. Everybody wants psychedelic therapy. So my question to you is, how do you think this book will be received among the Swedish public?
Yeah, Sweden is completely different from US in that perspective. And I mean, if you look in the narcotics, the list of narcotics, I mean, these substances are classified as no medical use. So my guess is it's not just start working with it, obviously. So they have to be reclassified to be useful, of course. So my guess is will not be that easy in Sweden. Changing, but I mean it's definitely interesting compounds. You must be very careful when you mess up your brain with chemicals, any chemicals, and I mean it's very complicated. The brain is so plastic, so we don't know what happens. I mean it's a lot of therapy today with use of drugs, and it's really don't know what happens. I mean it's very, very complicated. So I mean from my standpoint, we need a lot of research.
So that kind of segues into the question we started talking about backstage, which is there are plenty of substances that have been used culturally and then been deemed illegal as a drug, and then actually they've found some medical use for it, and they've been accepted back into society as a medicine. With psychedelics, that has not happened so far. Do you want to elaborate on that?
Yeah,
of course, the two of you can.
Up until early 1900s, morphine or opium actually was available at the the drugstore, basically. I mean, you can go and buy it. You didn't even need to have a receipt from a doctor. So people were supposed to know how to use it as a pain reliever. So and then it got illegal for different reasons. Then the same thing happened, basically. I mean, during the World War II, all the soldiers just used amphetamine and methamphetamine, and we don't talk much about that. And after World War II, it was a huge excess of amphetamine out there, and it got illegal again. But still, we use. I mean, amphetamine is a pharmaceutical entity that's used for some conditions, obviously. But it's interesting to say that the psychedelics haven't ended up in the same. I mean, morphine is used all the time, amphetamine is used, but not the psychedelics. So it seems they treated in a different way.
So the next question, why is that? You have any take on that, Matt or Rebecca?
Compared to other drugs of abuse, psychedelics are sort of like the drug class that doesn't belong. They are very different.
Yeah.
And if you know the Sesame Street, the American children's TV show, like which one of these things doesn't belong with the others is one of the games. And it's like the psychedelics are the type of drug that doesn't belong with the others. One of the big differences with other abuse drugs is they're not addictive. So they can be used dangerously. They can be used in a way that causes harm. But they don't lead to compulsive drug seeking. And we know that they don't cause the same changes on the brain's reward system, the mesolimbic dopaminergic system, that all of the addictive drugs do, from nicotine to opioids to stimulants like amphetamine, even cannabis to a moderate extent. Psychedelics don't do that. But that's a good thing. So that doesn't really, it's good that they're not addictive, so it doesn't really answer the question why. But they're also the drug that occasions the most powerful shift in conscious experience. And this can scare a lot of people. Many people, not everybody, but many people will say there was the time in their life before they took the psychedelic, and then there is the time afterwards. There are very few instances where people say that about other drugs. And with these other drugs, there are very few claims of lasting benefit, particularly from a single use. Most of the drugs people claim no benefit from. They might say, "Okay, it's okay. I'm not harmed overall. I can handle my use." But very few times do people say, "Amphetamine fundamentally made me a better person." Nicotine made me a better parent. I have a bigger picture on life. I have more meaning in life because of my use of cocaine. People don't say that. So again, that's kind of a positive thing to say, but the dramatic ability to alter someone's life, I think, is scary to the culture. And there are examples, in fact, of people who have long-term harms from a single use, not in safe or clinical research, but in reckless use. I'm not saying that most people who use, in the wild, most people aren't harmed, but most people who drive a car without a seatbelt aren't harmed. So we're talking about probability here. So, the ability to dramatically alter someone from a single use, both good and bad, it's very scary to culture. I mean, and there is a reason to be very cautious as a society in how we deal with these things. We have to acknowledge any powerful tool can likely be used for both good and for bad.
And I mean, it's always like a permanent change, something that you really can't go back. That's always scary.
Right.
So I mean, in this case, if it's as you say, it's a one-way door.
Right.
You have to think carefully before entering that one.
Yeah.
Yes, and I do see clients like that have taken trips that have and they don't even have to have gone badly. Like they can be on a trip and then they come back, and then it can be things like meditators who've taken ayahuasca, and then they come back and then they get frustrated. They can't be on that place anymore, and they also have symptoms that they don't really understand, like they've developed panic disorder. So and it's connected to the use, but it's my reasoning in that is that it's connected to their emotional life, and we're very emotion phobic. So we're afraid of the emotions. So when we pull them up, we see things that maybe we weren't ready to see, and maybe we learned a lot by seeing, but it also dragged up a few other emotions that maybe we couldn't handle. So there's like the question of integration of such a powerful experience.
It must be incredibly personal. I mean, there were a lot of people who were really frustrated after seeing the film Avatar, but they couldn't be there forever. so obviously you can change your brain in different ways.
Right.
So,
and this idea of pulling up difficult material that then can cause harm if you aren't in a place to work with that material. That I'm an experimental psychologist, but I realize you're a clinical psychologist, and so this is something that is very common to much of good psychotherapy. I mean, the best treatments to anxiety disorders, including phobias, including social anxiety, is exposure to the thing that is difficult to deal with in the right context, in a safe way. But it's not supposed to be easy. If it's easy, it's not going to be effective. Right. So much of what we know about just good therapy is about bringing to the surface those things which are inherently difficult. And then, of course, you can look at life more broadly, and like so many of the very good things about life are inherently difficult. Growth and change, childbirth, healing from injuries are all painful experiences, but are, the fundamental aspects of life.
And the reward system in itself. If it's too easy, you won't get that happy.
Right. We're not supposed to be happy all the time.
Yeah, and it's not supposed to be easy, but it's supposed to be safe. So that's why the setting is so critical, I think, when because it's the same thing with emotion-focused therapy is very powerful. If that's not, if lots of emotions come up and I sit there and judge them, that's going to be traumatizing as well. So, but I think that's very important.
I wanted to make one comment. I realized I didn't in response to your original question to me about why now. One very important thing is that the ability of psychology and psychiatry to treat disorders like depression and addictions has not improved for many decades. Our basic medications, for example, that treat depression work on the same fundamental mechanisms as were developed a half century ago. The ones today are slightly safer, but they all augment extracellular serotonin through one mechanism or another. And there is an incredible amount of suffering in the US. We're going through a suicidality crisis. The rates are increasing. Addiction to many substances, including opioids, but also alcohol and tobacco are long-standing killers. So that's a big part of why now. Folks, the helping professions are at their wits' end. They're like, we need to really explore because the suffering is great, and we've reached our limits to some of these traditional treatments.
Yeah, the suffering is great in society, and as a board member of the Network for Psychedelic Science in Sweden, a lot of people are contacting us, asking about, okay, where can I find a psychedelic treatment? And of course, there are no psychedelic treatments in Sweden, and there is currently no research going on in Sweden. So let's say, even if these substances work, they work in a therapeutic setting. What if this catches on and we see this pollen effect, and suddenly everybody starts taking these substances by themselves? do you see a risk for a backlash in society, and the same thing from the 60s happens over again?
Anybody?
No, please.
I think there is that risk, and I think we need to be the history of this research is full of lessons, and we need to fully know that history and live by those lessons. One of the very important lessons is what I've said before. There are risks. Any powerful tool can be used for good or harm, and the nature of the effects will depend on the context, as you said earlier. So we need to be very clear. The results that we see in clinical research are not to be expected, in any use. Now, it's complicated because many people, frankly, have used, and I've conducted survey research on this, many people have used, on their own, sometimes for recreational reasons, and claim benefit. But there are other people who have used on their own and claim to have been harmed. So what we do know is that we can maximize benefit and drastically minimize the risk. All of the major known risks of psychedelics, exacerbating psychotic disorders, engaging in dangerous behavior during a bad trip, increasing heart, psilocybin and LSD increase heart rate slightly, so those people who have a severe cardiac illness can be harmed acutely, so we can screen for all of those things. We can screen for. We can, through screening, monitoring, and follow-up care, we can squarely mitigate those risks. So I think it's critical that we are clear about this, and we can't fully control what people do in culture, but to speak very clearly and consistently about the risks. And hopefully there won't be a backlash, but some of it is going to be outside of our control. But I think given the level of suffering, we have a responsibility as a field to cautiously pursue these novel treatments.
So, Ulf, you mentioned that obviously we need more research, but I'm wondering, the US is one thing and Sweden is another. Sweden has traditionally had a very conservative and harsh take on illicit drugs, lumping all drugs in together. And what are your takes, you Swedes? How is this going to be received in Sweden?
Yeah, I mean, obviously it's highly controversial, and I mean, just take the UK as an example with David Nutt. I mean, his fantastic Lancet paper on how dangerous are drugs, and he got fired basically for a scientific investigation, which is really weird. I mean, science is just the way. I mean, we can provide data. Politicians decide. I don't decide things. I provide data, but we must provide more data. We obviously don't know. We have no idea. We have no idea how it works, if it works, how much. No idea. It might be very useful. It might be completely useless, but we must investigate it, and I think that's highly important. That's not the same thing as legalized. That's completely different. I mean, this is purely for medical reasons, and I mean, if there are drugs that can actually help, I think we should try them. Absolutely. No one would. I mean, basically, if we just remove morphine, which is a highly addictive drug, that would a lot of people would suffer. I mean, that's a major painkiller. So.
Yeah, and I think it's interesting also connected to what you said before, that it's not addictive. With if it's available for the people that need that kind of shift in medical care or with a psychologist or some kind of trained professional, then that kind of lessens the reasons to do it on your own.
Right.
Because it's not just for the kick of it. It's for more of a transformational purpose for a lot of people, I think, that take it even on their own.
And so how controversial is this? So you, for example, you work in your private practice. Let's say if you would have an employer or if you would work for Landstinget, would that affect your decision on being on this panel even?
No, but I've meditated a lot. I don't know what my ego would say, but I drag it here.
I want to come back to how these substances actually affect us. How can these substances actually alleviate suffering in patients? So, Matt, in the book, there's a quote from you where you say that these substances dope slap people out of their story, and you continue to describe these substances as rebooting the system. Could you elaborate on this?
Sure. Well, those are obviously pretty crude, ways to, express what seems to be going on clinically, and we're doing our best to figure out both the psychological and biological mechanisms behind that. But I think a credible emerging story is these drug experiences can profoundly increase mental and behavioral flexibility. So we do know in terms of the way they work on the brain acutely, there is a drastic increase in global connectivity across the brain. This isn't about which brain area light is activated or not activated. This is about the communication or synchronization across the brain. There's a dramatic increase in this communication, and this is consistent with subjective experiences where people report novel insights. They report a more profound, convincing realization sometimes on the same topic that they maybe had thoughts about. Like the people I've done research helping people quit smoking with psilocybin, and typically they don't learn something new. I mean, they know smoking is harmful for them. They've wanted to quit. They know it's important to extend their life and be with their family. But they then have an experience sometimes where they feel these things profoundly, deeply. And so this might be sort of the psyche, the brain, or the psyche, if you will, parts of it that we kind of put away. It's in the unconscious realm, which is just to say it's not in our working memory. We are not manipulating it. We are not thinking about it as we're making our decisions. It's too tough to have all these things in mind. Like when you smoke a cigarette, you think, I'm choosing to maybe not be with my child when they graduate from college. Like you can't go through life thinking that heavily about everything. But on a psychedelic, oftentimes these things are brought to the forefront, and one cannot help but to view them from this deep perspective. So they seem to increase this mental flexibility. Sometimes people have profound states, such as a sense of unity, or a mystical experience where one, for example, feels at one with the universe, with their fellow humankind, with other living beings on the planet. And this can be such a convincing experience for people. And it's not necessarily supernatural. Like this could come along with the belief in God, or be from a completely materialist perspective, an ecological perspective. But when people have stronger experiences like that, they are more likely to have quit smoking 6 months later. They are more likely to have less depression and anxiety in our cancer patients that we've studied. And in the healthy normals, the people without problems, they're more likely to report having higher well-being, and their neighbors and their spouses and their coworkers also report that they are easier going and are having a higher quality of life. So there seems to be something about this acute, powerful learning experience. It's less like other psychiatric medications and more like psychotherapy. It's the best combination of the two, I think, where people can change and learn from an experience through that mental flexibility.
But correct me if I'm wrong, but if you take LSD, for example, a second time, it might be a completely different experience. And that's, of course, makes it really complicated.
Right.
So you have no idea what happens the next time.
Right. It's the variability in effects is one of the hallmarks. Unlike, morphine is going to be a reliable
absolutely,
pain relief, and the mood's going to be lifted, and So and sometimes, and we've done studies where we do have multiple sessions, and and sometimes people have horrifically difficult experiences, which are not dangerous in the safe context, but nonetheless they're not enjoyable.
No.
So sometimes they're very frightful. And maybe the next session, or maybe an hour later within the same session, they have what they claim is the most beautiful, meaningful experience of their life. And our research suggests that it's not like the average of those experiences, but it's the best experience that is predictive of the outcome. So I think clinically it seems to be useful to have a few sessions where you're increasing the chances that someone has one of these highly positive experiences.
But I'm also wondering what's the problem with if it's in a safe environment, if you get negative affect, or if you have different, like if you sit with a person and ask them, how are you feeling right now? How are you feeling right now? How are you feeling right now? You'll get different answers because that changes. So isn't, like, in my mind at least, one of the therapeutic goals is to be able to be with yourself throughout different...
My guess, this will be an immense clash between medicine and psychology, since in order to use a new pharmaceutical entity, or an old one, but still a new one for this setting, you must do a clinical trial. And if you get different results each time, that would be a very complicated study to explain.
Yeah.
So, and I have no idea how strong the placebo effect is.
What
Probably
different
very low.
results is different from different experiences.
Yeah, but still, there must be something that you can measure. I mean, from a governmental perspective, that must be measurable, and that would be one problem for actually getting this into a well-working trial.
Yeah, and there is
that's bureaucracy, but still, it will be a problem.
There is that variability, but in fact, we have measured a good number of things, including the gold standard psychiatric measures such as the Hamilton Depression and Anxiety Inventories, which are clinician-administered, like I said, gold standard scales, and other ones like the Beck Depression Inventory and others. And we're starting to see some commonalities on the biological measures. But yes, there is the variability. And unlike other psychiatric medications, like I said, we repeatedly are finding this correlation between the nature of the subjective effects and the outcomes. So it's a challenge, and I think it's a surmountable one that we're doing.
Absolutely, but you have to do really clever clinical study to get the answers.
And in fact, with clever designs, non-traditional experimental designs, we've addressed in different ways the placebo issue.
How strong is that?
So there is a strong expectation effect, but we have found through different techniques, through using a true placebo, through using active comparators, through using lower doses of the same compound, that it's not all expectation or placebo, that in fact a high dose of psilocybin really does something beyond just the placebo effect. But in fact, I think, and we have far more to learn about this, whatever psychedelics are doing, I think is tapping into what we call the placebo effect. I mean, we normally control for the placebo effect, and it's kind of annoying experimentally. But in fact, it's this miraculous, virtually completely not understood ability of the body and the mind to heal itself. And somehow, my inclination is that whatever psychedelics are doing when they're helpful for mental health is harnessing whatever that is that we're calling the placebo effect. They are powerful ways of connecting the mind and the body. So I think we need to address the placebo effect, but then there's a lot more to explore in terms of that connection.
Interesting. So, for the last 2 decades, mindfulness meditation seems to become an increasing part of evidence-based protocols in psychotherapy. So seems to be some kind of emergence between the psychological and the spiritual in some sense. So a lot of people, like you described, people are describing mystical experiences. So my question is, first to you, Rebecca, can a substance, a medication, be spiritual?
If the substance can be spiritual or induce spiritual states?
Yes.
Well, it seems like it, doesn't it? Reading this book, it does really seem like a lot of the meditation states, like the whole connectivity, especially if you think Buddhistic spirituality, but also mysticism, like the mystic states of being one with the universe and all of that. It seems to be the same thing, honestly. That you find in all religion, and that maybe Buddhism talks a bit about more than the other religions. So yeah, I would say so. And I agree with also that spirituality is moving into the psychology, or maybe spirituality is being psychologized as well. So it's not necessarily that spirituality is taking over psychology. It could also be that psychology is actually moving into spirituality, and but the entire third wave of CBT is mindfulness based. So yeah.
So we're moving into that kind of the complicated bureaucracy of science that you mentioned, Ulf. But there seems to be some studies trying to grasp these things in a scientific sense anyways. I know that at Johns Hopkins that you're doing some research with religious scholars and comparing their experiences. Would you like to just tell us something about that?
Yeah, we're nearly finished with a study using religious professionals, so priests, rabbis, religious leaders in a variety of different faiths. Buddhism, basically as wide of a variety as we can find, and assessing the nature of their experiences under a high dose of psilocybin, and looking at the long-term effects. It's sort of it's a small study, but it's one in which we're sort of casting our nets wide in terms of the questions. There's not one kind of very focused hypothesis, but a number of interesting questions. It's a very preliminary study. But yeah, is the nature of this experience similar across people from different faiths? We don't have a whole lot of, it's not a study with a large number of participants, so we don't have a whole lot of experimental statistical power to address that, but it might provide some interesting trends. And then are there long-term impacts? Is someone better able to kind of like serve the people within their tradition better as a result of having one of these experiences? And what do they think? Do they think it's a genuine spiritual experience? Or, I mean, there is no right or wrong answer on this. There's no way to prove this, so the best you can do is get opinions from different people. So it's kind of interesting. Let's ask this like priest or rabbi who's been, part of some religious tradition for decades. What do you think about it? Here, have some psilocybin and then ask them after. What's up? What was that?
So yeah, seems to be like one of those creative steps to perhaps move one step closer, what that
Right.
Ulf was asking for. So let's say 5 or 10 years in the future, more studies come, and the studies in the phase 3, the results of the phase 3 studies are just as promising as the studies we've seen now so far. How will this be implemented in society? Will you just go to your psychiatrist and they will give you LSD and you will lie down in the couch, or who will get this treatment and how will it look like? Open question.
There will be one major bureaucratic problem. No one will pay for the studies. since no one can earn money. I mean, these compounds are known for 100 years and or less than that. So,
but in this scenario,
it's
the studies are done.
Absolutely,
the data
but
is
still,
there.
I must say, I mean, it's very hard to get a patent. And if you can't get a patent, you won't earn any money. So it's very hard to make the studies. So that is a major problem, obviously, with known compounds. I mean, we can do scientific investigations, but it's very hard to actually produce it.
Would you say that there's an interest to that those studies not be made?
No.
Even like
I'm just saying that in order to make these into a medicine, you must do phase
Must
1, 2, 3
finance all the
clinicals,
studies.
and that costs about $1 billion maybe, and someone must pay that.
Yeah. Now,
So,
there are some answers. I agree. We don't know these. It's a big question. How is this going to play out?
Exactly.
Is it
It's
possible?
a very practical question.
There are some things to say about it. With some of these compounds, in fact, a lot of that phase 1 work is done. In the U.S., the National Institutes on Health has spent hundreds of millions of dollars to look at the harms of MDMA, and that has actually provided very solid toxicology phase 1 data that, like, you're able to skip millions of dollars and move on past that. And in fact, with the other compounds, LSD and psilocybin, there was quite a bit of human research in the older era, so we've been able to skip, because it's not first in humans, we've been able to kind of skip some of that. But nonetheless, very expensive work is ahead of us, so your major point still holds. But there are some things to consider, some different models. There are now multiple nonprofit entities, essentially nonprofit pharmaceutical companies, such as the USONA Institute and MAPS, the Multidisciplinary Association for Psychedelic Studies, that are pursuing this idea of having this nonprofit model drug sponsor, and you know, that's an open question. Will those models work? There are multiple commercial entities that are exploring and at the beginning of developing psychedelics as medicines, but it's a big question. Is there a profit in it? And really, I think no one ultimately knows.
No, and I mean, the minute FDA actually proves it, everyone will produce and sell it. So
right.
So
it may be that the money is to be made in the treatment delivery.
Yeah.
I mean, this is a professionally expensive model, and so it may not be. It may be like non-traditional with medication. It's not in the compound to make your money, but in the having the clinic, having the professional staff with the highly specialized training to provide this service.
I also find it interesting that when we're talking about psilocybin and non-profit, that since it seems to have the power to kind of save people, it's like it has this religious almost undertone. Maybe other forces will want to give their time, or maybe it's not the standard way of finding a.
We can agree it will be a very non-traditional clinical
And
trial.
also,
from so many aspects.
Because there is a difference also with these substances and, for example, SSRI and other medication we have to, as far as I know, I'm not a scientist in this, but that the drugs that we have now are kind of to like put a blanket on the person,
Mask
or like
symptoms.
mask symptoms, and this is something that wants to kind of like, where is the person,
Right.
So that's a very different process.
In fact, look, I mean, I would go so far as to say, based on the data so far, and we always have to follow the data, they look like cures. The data for both psilocybin, the most advanced data is psilocybin for treating depression and anxiety in cancer patients, and with MDMA treating post-traumatic stress disorders. People afterwards score in the range where they're not diagnosable with those disorders anymore. Like, they look like cures from like a single or a couple of doses 6 months or a year later. So this is remarkable. And if you have the right contingencies in place, like the same payer who's paying for the immediate treatment and the long-term ramifications. Like, is this person going to show up to the emergency room year after year after year? I think a case is to be made. There is a long-term financial incentive to actually cure people and to use these compounds in the right way and not just to treat the symptoms.
Yeah, and that makes a lot of sense, I think, psychologically, to view it as symptom or as cures, because if it goes to the cause
Right.
of it's exposure therapy, so then you face your emotions and you face your demons from maybe the past when you learned your behavior. Yeah.
So, if one of these medicines or several will be out on the market, what substance will be first? Because there are several different substances that we're doing research on right now. Which one will be first, and for what condition?
I think the most incredible competition, and I love it, is like, I have to admit, there's always a little competitive side to me. Will psilocybin treatment, and I think psilocybin for depression or MDMA for PTSD, be the first? It's going to, in the U.S., I can speak to, it's going to be one of those two. My work has been on psilocybin. No matter who gets first, we all win, I think, because I'm a big fan of the work with MDMA, and those are good colleagues doing that work. So I'm looking forward to the game changer when we're past the first approval. Then it's like, then the work is just beginning. Then it's looking at other treatments. Then it's looking at other compounds. What about LSD? What about the hundreds of other molecular entities that affect the serotonin 2A system in slightly different ways? We have a whole library of compounds to test, and we can test the interaction between all of these compounds in different modes of psychological therapy that are known and empirically supported. So, yeah, the fun really begins even once we determine who wins that first indication competition.
Okay. So I just want to hear, because I'm so curious, after those two top-tier candidates, what's next?
I think there is still a stronger record of human safety for LSD than any of those two compounds. There were a lot of people that received LSD in clinical research in the older days, and we have stayed away from LSD just because that was so politically sensitive. In the late 60s and early 70s, it wasn't the folks, using recreationally. We're not using mushrooms. That was in the U.S. That was more in the mid to late 1970s when that started. It was LSD. When Jimi Hendrix said, "Are you experienced?" he was talking about LSD. I mean, that's the thing that scared the bejeebus out of the status quo. And so, I think looking at psilocybin has in part been a strategic move to not kind of scare people, but in fact, they're both serotonin 2A agonists. They work in the, these are like the difference between morphine and oxycodone as opiates, or like the difference between diazepam and some of the other benzodiazepines like triazolam. They're slightly different ways of interacting with the same receptor system. So, and again, there's more safety data still on LSD. So I think the time to return to LSD is about here. There's a lot of therapeutic potential in LSD.
Okay. So we have a few minutes left, so I would just like to see if you have any closing words, Rebecca.
Yeah, always when I talk about these things with or the spiritual versus the ego, or the different system awareness versus the focused attention, the contracted versus the expanded. I always end up thinking about where we are as a race right now, right? Where humanity is at, and what do we have too much of, and what do we have too little of? Because of course it's a balance. We need our default mode network. We need our egos. We need our contraction and our focus. But what are we misusing right now, I think is that. So that's our true, and clients even agree when I say, well, you're misusing thought, you're a thought addict. Because I think in general, as a society, we are, and that's not going to get us out of where we are right now, environmentally, and the next step for us is to actually broaden.
Word.
Yeah,
And
anytime we change, we make drugs working in the brain, we have to be careful, but there's no reason not doing research. It's a fascinating area, and hopefully there will be some spectacular results.
okay, time will tell. So, I would like to thank the three of you for this very interesting discussion, and I would like to thank the audience for coming here. I would also like to advertise for another event that the Network for Psychedelic Science is doing in cooperation with Forum Debatt at Kulturhuset, which will be on the 5th of November. It will be a very interesting movie screening. The event isn't up yet, but keep an eye open. I don't think anyone will be disappointed in that event either. So, thank you, everybody. And thank you.
Thank you.